So let's start with something that you may or may not be familiar with. So anybody who has ever read The 5 Dysfunctions of a Team, we're looking here at, what is a high performance team versus a dysfunctional team? And trust me when I say this, there are dysfunctional teams out there, but there are also very high performing teams. And I've worked with both, and I've worked with the people who are in the middle. When we look at this, triangle or this pyramid, we look at, what are some of the fears that we have as leaders to actually make sure that, we're doing everything we can to keep the right people on our team and make sure that they're motivated to stay. And no one wishes to have a dysfunctional team, and no one wishes that, somebody is not doing their job, but then it comes down to questions of who do we blame? Is it the person? Is it us? Why do we let it take us over? So many times have I worked with practices or practice leaders where they kind of just let, the bad apple spoil the bunch. They let the toxic employee get away with things because it's a fear of losing them, and then also running the risk of, am I going to be able to fill that position? Sometimes we're avoiders. I've done plenty of personality assessments with dentists, and probably the number one answer I get is being an avoider. Nothing bad, nothing to be negative with, but making sure that, we're not avoiding conflict when it does come up. And we create rules around that, not just for you, but between your team, which we could talk about. And if we don't have confidence in our team, why are they there? One of the things I'll tell team members who might run into a place of their own scarcity of being in the practice is the doctor wouldn't have brought you here if they weren't confident in your ability. And if you're not confident in their ability, they might not be the right person to be there. So we'll get to that. As we look at the pyramid, we look at, what are the results that we're trying to get? How are we creating attention around those results? So everything from having a key performance metric and indicator within the practice to, following protocol. And one of the things that we will be talking about later on in this webinar is about creating those protocols for the practice. Avoidance of accountability. So poor performers are managed through and being held to accountability. I can honestly say, and I go to practices and I interview team members on an individual level, one of the things I hear from a lot of those team members is so-and-so is okay, but, doctor never holds them accountable to doing their job, so they kind of do what they want to do. And, it's noticeable by your team, which also demotivates them or your A players to actually step up to the plate even more when they know that they can get away with things that your C players might be getting away with. Poor performance, maybe you have a hygienist who's basically just doing prophies all day versus doing a service mix in their chair. Okay. And then you have another hygienist who is talking about treatment, getting patients to say yes, actually diagnosing perio in their chair and getting patients into the right state of health. Okay. So do we, make sure that we're holding them to the same levels and the same expectations? Lack of commitment. You're going to be able to tell those team members who are committed versus not committed to the day-to-day of the office. Great example is who manages, just making sure that everything is clean, taken care of. The chairs are clean, the operatories are clean. Everybody has their role, but it doesn't mean that other people can't also contribute to it. And when we have role scorecards and job expectations, it's not just a list of tasks. It's really a list of accountability based on, what you expect from them. Biggest one I've always seen, because new patients is always something that's brought up, is that every single team member in their job role and their role scorecard is having to be responsible for asking for referrals and helping market the practice. Now, are they going out and going door to door to market the office? No, but what they are doing is patients satisfied, they're happy, they're leaving the office, they're asking for them to send a referral over, which should also help enhance, the numbers that are coming in. Fear of conflict. Again, sometimes we're natural avoiders. We don't want conflict. We don't want to shake things up. We don't want to we don't want an issue where somebody's going to leave the office, and leave us in a lurch. Sometimes that might be a good thing, in all honesty. But if we avoid the conflict, and let it go, this is where you end up with your A players leaving and your C players staying. If we start confronting the problems, more effectively and quickly, and develop solutions around those problems. I have a little rule with all my practices, and I know a couple of you are on here. But one of the rules I have is the 24-hour rule, and this goes for everybody in the office. If somebody identifies an issue with another team member, they have 24 business hours to actually resolve it with that team member, or else it needs to go away after that. Okay, so it's not going and playing, mommy versus daddy, and it's not about, tattling on people. It's about, let's be adults and actually confront one another about what's going on in a very constructive way. And I actually teach a lot of my practices how to have that constructive feedback coming from a book called Crucial Conversations. So that creates, a little bit more ease in terms of, being able to confront conflict up front. And then lack of trust. Honestly, this is something I hear on a pretty regular basis, which, again, it gets to a place of, I don't know if I could trust that my team will do the job the way that I expect them to. But if we don't let them do the job that you're expecting them to, they're not going to do it. So this is about handing off the trust. And we're going to talk about these things more in depth as we go along. Okay, so what are the goals? What goals do you have? Some people have goals, especially ourselves as leaders and also team members. Goals can be financial. They can be about your health. They can be personable. What goals do your team members have, for themselves? Do we know? Have we ever sat down and asked them? Now, we are at the first quarter of the year, and I don't know if any of you have ever done a New Year's, summit with your team members where you basically go off site, you spend a day with them to go over what did we do in the last year and what do we want to plan for this coming year as a team. And granted, if you're a practice of, any 5 people or even 50 people, it doesn't matter the size, it matters of the quality of how you want your practice to get on a trajectory of growth. And one of the things I love to do with teams is, it sounds a little corny, but it's to give them something that they are kind of focusing in on. And I call it a power word. And power words are a word that is kind of stuck with them for the entire year. And it's how they're going to be, what their mindset is. Some examples of power words: intentional, driven, strategic, focused, proactive, accountable, empowered. These are words that a team member can instantly, latch on to. And, every single decision they make is actually guided by that power word. So do we have the right intention behind making a decision or running through a process on a day-to-day level? So think about that as you're working with your teams. Okay, so how does this start? Well, first of all, we need to have a vision. And your vision is your destination. It's where you want to go. And a vision, I like to do one once a year with everybody because things change over time. A vision should be basically a SMART goal that's getting you from one end of the spectrum to the other without being so overly exerted that you're doing too much at once, but more so keeping it simple. And then you have goals to get you there along the way. So is there a vision in your practice? Does your team know where you want to go? And not only that, do you and your team actually, speak together about that vision? Do you create it together? And I love the fact that teams create these together because that's where the buy-in comes in. That's where the alignment's going to come in. Vision should be part of every job description and role scorecard. And not only just the vision of the practice, I'm talking about the vision of their role. What is their purpose? They're not just a dental hygienist who's cleaning teeth all day. And I know I used the C word, okay? And they're not just a dental assistant who is, suctioning spit all day. what is their purpose? And if they understand that purpose of their actual role, then they start taking their job a little bit different, in a different manner. And when you do these things with your team, you create a couple of SMART goals. And if those of you who aren't familiar with the acronym, it's specific, measurable, attainable, results focused, and time bound. Have your team take the opportunity to create SMART goals for themselves to help them move in the right direction and work with you on setting clear expectations at the same time. Now, how do we do this? We do this through transparent communication. I am not the type of leader who sugarcoats unpleasant news to my team. I want to make sure that my team is knowledgeable and I'm upfront with them with what's going on. And I know that my bosses have done that in the past as well. So thinking about transparent communication fosters that trust and accountability between you and your team. And again, and I know I sound like a broken record, so many times have I dealt with practices where I don't want to share my numbers with my team. They know how much you charge for a crown. They know how much an implant costs. They understand, what's being spent on inventory. It's just not talked about. And this is where key performance indicator metrics come in place to make sure that, you're aligned with what you're trying to achieve. They're aligned with what they're trying to achieve. And it's not so much focusing on the negative and only on money and production. It's really focused in on how are we growing as a business? Because those of you who have gone through the Dawson curriculum, you know that, part of what you do is about creating a different type of mindset for patients to accept treatment in your practice. This now is a part of getting your team to be aligned with how you're actually doing that. Okay, so role scorecards should be a clear, decisive way versus punitive to give clear direction about the role and better set you up as leaders. Because basically what you're doing from there is you're leading through others versus micromanaging them. Okay, and this is something that you're going to talk to them about on a fairly regular basis as you work with your team. So now when we talk about regular progress reviews, I think when I speak to a lot of team members and I have those interviews with them, one of the areas that I get is, or one of the responses I get back from a lot of those team members is, I don't know how I'm doing. I'm not quite sure if I'm meeting the expectations of the doctor. And, I just want to be able to do more, but they don't know what more is. So when you meet for team performance reviews, we want to make sure that we're aligned with metrics. So giving you a few examples for a scheduling coordinator, do we know what cancellation rates look like? And again, we're not pointing this out to them to say, oh, our cancellation rate's 20%, you're failing. Okay. It's more of, hey, our cancellation rate is about 20%. Let's strategize together on 3 areas that we can best improve by, and then get that decreased by at least 2 to 3% in the next 90 days. So as you notice, I'm giving a very SMART goal to that individual, but making sure that it's not being held, they're not being held to this exorbitant standard that they're not going to be able to meet in a very quick amount of time. Treatment coordinators, case acceptance value or percentage. It all depends on how you look at it. And I look at it both ways. Hygienists, theirs is on retention percentage. So how is recare percentage? And yes, it's also focused through scheduling. However, if patients are canceling hygiene on a regular basis, we start looking at hygienists and making sure, are we providing enough value for that service that they're coming in for? Not a cleaning, but the hygiene service and oral cancer screening itself. And are we actually talking treatment? Because who does the patient trust more than anybody? Who do they see more than anybody? It's their hygienist. So we want to make sure hygiene is supportive of the doctor's treatment, as soon as they walk out of that room. Dental assistant, again, we go back to case acceptance and schedule productivity. So if the patient's left alone in the operatory with the dental assistant, it shouldn't be silence or just talking about movies and animals, but it should be focused in on, hey, you have this other treatment that needs to be done. Let's go ahead and get it completed. And then for an associate, if you have associates in the practice, it's hourly and daily production goals. Looking at their schedule. If you have a brand new associate out of school, it's going to be about doing case conferencing and building them up to help them speed up a little bit more, build their clinical skill, and work on being a leader in the practice with you. And then the same thing, office managers. So are you working with your office manager to meet with team members at least 30 minutes a month to discuss any concerns or talk about their performance? I'm an advocate of one-to-one meetings. And again, in a busy dental office, it becomes a little difficult to figure out when to do these things, but set 30 minutes aside. If you have 5 people on your team, do a lunch meeting with them once a day. Or if you're working a 4-day week, maybe you do 30 minutes, within the week for each person to sit them down, talk about their goals and talk about performance. And again, should be their meeting that they're running. And I've given plenty of agendas for team members to be prepared for those meetings. So how do we make sure that they're picking up, what you're trying to put out there? If we look at, helping the team members increase what they, the goals in the practice. So for example, if overall retention in the practice is 72%, we're not going to tell them to get to 85% in 90 days. We're going to let them know by the end of the quarter, let's get 72 to 74%. Why? Because it's a very slow moving number. We want to set the expectations and give a couple of strategies that they are going to utilize to get them to that number. Okay, so moving forward, empowering autonomy. So the best motivate and retain A players, empowering autonomy means giving them the freedom and the responsibility to own their roles, make impactful decisions, and innovate without constant oversight, i.e. micromanaging. High performers thrive when they're trusted, valued, and challenged. Again, this is a big ask of a lot of dental practices because, we know that you as a business owner have 100% stake in the business, and we don't want that to go awry in any way. However, sometimes we're not giving the ownership, with parameters, of course, to those team members. They feel that they are they're not able to move forward in the right direction. Okay. And they're also not looking at it from the advantage of how to best perform in their role. So when we look at this, letting team members make decisions take a lot of trust. Okay. It's not something I would just freely give to everybody. It's about, it shouldn't be a culture of seeking forgiveness versus permission. But when training and support are a regular part of your practice process, then trusting their decisions, if it's not part of that, trusting decisions will make it all the more difficult. So in order for your team to start making those decisions, we have to make sure that we're training and guiding them the right way. So when we do that, it's looking at here's how the process goes. Now, also as leaders, we have to identify when mistakes are being made. And we're also not slapping everybody on the wrist when the mistake's being made, but what was the lesson learned from those mistakes? Okay. How do we turn this around moving forward in the future? How do we make sure that it doesn't happen again? And I would say the best employees I've ever worked with are the ones who, readily look at the errors that were made and then quickly recover from it, which means they're not doing it again. They're not doing it repetitively. And if they are, this is where you have to get to the point of confronting them again in a very positive way. If you have to keep taking that confrontation even further, that's a whole other conversation that you're going to be having with them and maybe inviting them to be successful elsewhere at some point. Okay. So again, think about this as you're putting the trust in them, because you want to make sure that you're giving them, the autonomy to help with these decisions, but we have to make sure that we're training them properly to get there. Okay. So when we get trust and responsibility, we give trust and responsibility. Trusting employees, fosters a different type of culture. Okay. And I've been in practice situations, I've been physically to practices where you could cut the tension with a knife because no one trusted each other, no one spoke to each other. Patients noticed it, and it became very uncomfortable. And again, with a small group of people, you want to make sure you have the right culture in place. Okay. How do we do that? We start, letting them know, great job. I appreciate the work you've put in. Dedication and commitment to this has been very commendable. Looking at what went right versus what went wrong. Okay. And even I've gone as far as, and again, I'm going to give you a little corny, tool here, but I've had some doctors put pennies on one side of their lab coat pocket or their pants pocket. And then each time that they gave a compliment to a team member during the course of the day, they moved one to the right side. So if they have 5 members of their team, the goal was that they gave 5 compliments. And if they did that by the end of the day, we know that they've given positive feedback to their team. Sometimes it's hard for us. And I'll admit it myself. Sometimes I really have to catch myself to make sure that I'm acknowledging my team in the right way, every single time. And sometimes I even myself can get a little negative. But if I, really take the time to know that I have faith in their ability and I'm going to hand something off to them, then I'm giving them the trust to do so. And then I'm acknowledging what they've done. Okay. Now we get to the B players. Okay. Everybody always wants to hire the A player. Everybody wants everybody to be an A player, but you are going to have B players in the office. Okay. Now, in the industry right now, we're not getting as many stellar employees as we used to probably 5 or 6 years ago, but candidates are still out there. And some of those candidates are, may not have a dental background. They may not have a background in using a DPMS. They might not have a chairside background, but you want to consider the pros and cons of hiring those types of people. And then B players sometimes too are the silent ones. They're really quiet. They sit back, but they do their job. And we need to find, ways to really influence that B player, maybe to become an A player later on down the road, but reassessing their job fit. And I've been in situations with practices, even recently, where we looked at, is this the right role for this individual? Okay. It's not that we wanted to fire that person, and I don't fire people, but it was more so that we had to reassess, is she really in the right place doing the right thing? Okay. And once we started talking it through, it became more and more clear to both the doctor and myself, that we needed to make a shift with their front office team. Okay. And that shift, he was afraid to make that shift because he was fearful that somebody didn't want to move out of their desk because it's the desk in the front office and they're the first person everybody sees. But at the end of the day, once the conversation was had and we saw the benefit, they saw the benefit of why we were doing this, then it actually became less of an issue, and they were actually really excited about it. So it's, don't, not consider something because in our own minds, we think that your team member is not going to agree. Think about it in the sense of what's going to be the benefit to them. And my last webinar, I recommended a book called Start With Why. It's one that I recommend to every dentist I've ever worked with. Go ahead and get it, go read it, and then you're really going to be able to give your why to every single decision that you make in the office to your team in a very clear way. So now let's talk about enhancing communication. Every practice I go to, I know I say this a lot now, every practice I've been to, communication is usually one of the top 3 things that, are needing to be worked on or a little bit broken. And there's a lot of reasons why, especially, when we're a busy practice and we're just getting through the day-to-day and we're making sure that things are going right. Sometimes we miss things, everything from, how we communicate in the morning huddle about what's going on through the day to doing a simple handoff between the back to the front or vice versa. But strong communication is a foundation of a high-performing team. By fostering open dialogue, running effective meetings, and utilizing right communication tools, teams can stay aligned and collaborate more effectively and drive better results. And again, when we have this good communication, this is how we keep team members forever, okay? Because we're being open with one another. And as it's clear and intentional, there's my power word, it eliminates a lot of confusion and boosts engagement and ensures that everyone's working toward the same exact goals. It doesn't do anyone good if we're only talking to 3 people versus all 8. You know, and I've been to morning huddles and I've seen how morning huddles run. And it's usually one of the first things I have y'all fix. But, you know, when a morning huddle happens and, you know, 3 of the 10 people are present and ready to go at the time of the morning huddle, you know, that actually shows me that communication is on a downward spiral. If only one person's talking, you know, if, you know, we don't have a true, you know, agenda of where we need to go, it's giving me an idea of, you know, we just need to work on how we're communicating with one another so that we're, you know, very connected with how our day needs to run. So that culture of transparency and connection will actually help you thrive as a practice. And when we have that open communication culture, it just encourages the team to share ideas. I'm an advocate of uncomfortable silence. Now, I haven't been silent in this because, well, I'm the only one talking. But, you know, I've been in plenty of meetings where I've asked questions and I will sit in silence and wait. And just like I teach, you know, a scheduling coordinator or a treatment coordinator, when they're asking a patient or telling a patient, hey, you're not coming in for your appointments, you know, why? You know, oh, you don't want to schedule that treatment that doctor recommended? You know, what questions do you have about that? And stop talking. Okay. With the open communication culture, it's going to foster, you know, that trust, boost everybody to have the right conversations within the practice. Team meetings should not be a session where everyone's griping at each other. It should be productive. It should open up any level of, you know, communication that needs to be had about implementation, about training, about patient care. Okay. And then we can have some fun stuff that goes along with that as well. Okay. And having those regular meetings. Now, my question to you, and maybe you want to type this in, how often are you having team meetings? Give me a number. How many days a week, days a month, days a year do you have team meetings? All right. So I think, you know, a lot of you are all over the spectrum. And again, there's no good or bad to this, you know, but having meetings, you know, I'm an advocate of a weekly team meeting. I'm an advocate of a weekly team meeting for 1 hour a week. And in that 1 hour a week, you're discussing a protocol, you're discussing implementation, you're discussing training, not all at once, you know, but you are having, you know, very productive discussions about the business of the practice. And maybe if you're doing 3 of those weeks about the business and 1 of those weeks about a training in particular, you know, it gives you a little bit of opportunity to discuss all areas. And in that meeting agenda, it's pretty set where, you know, you're talking about what happened in the past week, what do we have going on this week, and what are some new things that we need to broach, you know, and giving the team the opportunity. And I love the thought of putting the agenda up in the lab or the break room, you know, printed out, and up to about 2 days before the meeting, everybody has an opportunity to add to the agenda. Now, it doesn't mean you're going to get to it at that meeting, but it does mean it's something that we want to talk about. Because when you have a morning huddle, the morning huddle also has a very set agenda, you know, to discuss what's happening during the day and what we plan on for the day and over the next 10 days. And, you know, from there, if it starts derailing to other areas, you parking lot that piece and you put it on your weekly meeting agenda. Now, if you're going to do it every other week, I would say do a 90-minute meeting. So again, creates alignment between you and the team. You know, what do we need to go through? And I know that's a headache for every dentist out there is, oh my God, I got to do a weekly meeting and I got to come up with an agenda for it. Okay. it's going to come naturally to you. And also, there are definitely ways that, I can help you with that as well. With larger practices, you might be doing multiple meetings a month. One, it might be a board level. So when you have multiple doctors, and team leads, I recommend doing like a board meeting between that group of individuals and then doing departmental meetings and one big team meeting a month. Okay, so it sounds like death by meeting, but again, we're discussing the business, we're discussing the implementation, and we're also aligned as leaders and how we're going to execute amongst the team. Okay, so now we talk about the meetings. How many patients, we want to look at how we understand leading and lagging indicators in data transparency. So I don't know how many of you pull numbers on a monthly basis, or some of you do it on a weekly or daily basis. When do we look at those numbers? How do we make sure that, we're hitting the goals that we need to hit? One of the things that I do with dental, with dental practices as I work with them on an individual level is we set up a financial goal and plan. And based on that, we reverse engineer strategy from it. Now, part of that strategy is looking at the granularity of what are they doing on a day-to-day basis to ensure that are we hitting the right things that we need to hit on at that time. And we look at a leading indicator, which is predicting success, looking at what's future performance looking like versus lagging of here's a spreadsheet I did for the month, a month ago, and what are we really getting out of it? We're just kind of looking at what's past. So if we look at leading indicators, how many patients is enough? That's a leading indicator, because now we can look at if we set up a template in our schedule and we know we need to fill in, X amount of new patients, do we have enough space for that? Are we at capacity in terms of our patients to doctor and hygiene ratios? What revenue do we need to hit to budget? That's a leading indicator. Okay, so when I budget with the doctors I work with, I'm giving them a very set number to say, if you're working 194 days this year, doctor, and 1,300 hours, this is the goal you need to hit day to day so that you can maintain sustainable growth year over year. And the same thing for your hygienist. Okay, and what production blocks do we need to fill in the next 10 days? Leading indicator, if we're using a schedule template and we have production blocks open, are we looking ahead at that? Versus lagging indicator, how many new patients did we get? Okay, well, it already happened. So, now that it happened, what do we need to do moving forward? How much did we collect versus what do we need to do to hit revenue? And then how much production did we lose last week because we didn't fill the blocks because we didn't talk about it? So one of the things that we are incorporating here at the Dawson Academy with our consulting program is also partnering with Dental Intelligence to have an analytic platform for all of our clients here to begin looking at our practice as a leading, with leading indicators and looking at data transparency. And I know that's scary to a lot of dentists because, again, sharing numbers is not a comfortable thing for everybody. But then sharing those numbers and opening up that communication with the team to give them what those expectations are opens up a little bit more runway to get those team members to do what you're asking them to do and setting a goal for themselves. Because we'll talk about rewards in a minute. So now again, is one training a month enough to support the team? So we look at today's professionals are eager to learn. They want to learn. They want to harness, some drive out of them. Employees are meaningful through training. And again, you start as you do this, you start understanding who do we have that want to do it versus who do we have that don't. So, does a team member in your practice want to achieve a level of being a team leader, a clinical leader, an office manager? Do they want support and advancement of, where they're at in their role at the practice? So this gives us a little idea on how we effectively train team members. And being part of dental education, we look at opportunities for, helping with future clinical success, with that being things like our dental assistant training program. So we have our course on, that we train our dental assistants to basically align with you doctors on how you're implementing the Dawson philosophy. We are incorporating a hygiene training. So hygienists are getting clinically trained. There's not a lot out there. So we are going to be pioneering that through the Dawson Academy starting in Q3 this year. And then, of course, we have our Team 360, which is our business course to align the entire team with the Dawson philosophy as well. So it gives everybody a little bit of, exercise in taking some of that CE, because they all know how excited you all get about taking CE and what you come back with. And now you can get them aligned with that to make sure that they that they're understanding why you're so excited about it. Okay, career advancement opportunities. Again, what paths can we give to somebody to transition them into a clinical lead? And again, team of 5 might be difficult to do that, but a team of 15, you definitely might have somebody that, might take a lead role as a lead assistant or a lead hygienist. But even a team of 5, I would say, like, how do you turn them into CEOs of their own role? And making sure that, they're looking at their role as, they're 100% accountable to it, but also it's a contributor to the team as well. And, if they want to do those things, they feel supported in it based on how you're training them. And this is where mentorship and cross-training come in. So I love the mentor mentality. I've trained a lot of dentists to train their mentors, to be mentors, even dentists being mentors to associates. But one of the things that we do here and on the consulting side is creating a customized implementation plan to give everybody the availability and ability to cross-train team members. So I'll give you an example. If your front office won the lottery tomorrow and decided to take a 3-month world cruise over the next 3 months, who's answering the phone? And who's answering the phone the way that your front office does it? And how are they handling cancellations? And how are they doing billing? And how are they submitting for insurance? If you don't have a system in place that everyone is cross-trained on, and it's documented, no one's going to know. And then you're kind of in a place where, oh my God, what do I do when this happens? And I know that's happened to some of you. So, having that ability and, meeting together as a team on a regular basis is going to help drive that implementation and drive that ability to cross-train between each other on the team. So now let's talk about reward, recognition, and support. Now, there's a difference between reward and incentive. So we're rewarding for going above and beyond. An incentive is something that's expected. Okay, so when employees don't feel valued, there's burnout, there's disengagement, it could quickly follow. So we want to make sure that we're recognizing them, but it doesn't always have to be about money. Okay, now I'll throw out some fun money, incentives that you could do as a team once in a while when you're in a meeting. But, simple gestures like extra time off. Now, I've had a couple of practices in my past actually create their vision around taking more time off during the holidays. So if we hit our goal of $1.2 million within the next 12 months, we're going to take off two extra weeks at the holiday. Okay, that's a great vision to have as a practice because it's going to get everybody aligned of, I get 2 weeks off at Christmas. That's great. But, the public acknowledgement is another one. I did this with a team in their team meeting a couple of weeks ago. They had a summit, New Year meeting together. And the doctor, I suggested that he do a cash grab bag. And what the goal was is that everyone was giving a compliment about somebody else in the practice. And as those compliments were given, that person's name was put in a jar. And, during the course of this 6-hour meeting, they did this 3 times. Someone pulled the name out of the jar and they got to go into a cash bag and pull out a bill. It could have been a 20, a 50, or $100 bill. So it actually excited everybody. And again, I know I said it's not always about money, but sometimes, it doesn't hurt. And, exploring other ways to recognize and drive motivation for that long-term retention is part of, this reward system, and also how we celebrate that as a group. So bonusing. Okay, I love the bonus structure. I love bonus systems. There's been so many out there that I've seen, and you look at it, do I bonus everybody equally, or do I do an individual goal? Do I, pool together, like 10% of what we went over in our financial goal? And, do I break it down by, how many hours they work? So there's different ways of doing it. Do I base it on certain metrics? So if we're going after a metric of decreasing cancellations from 22%, maybe we throw it in 3 different tiers, and each tier is getting a different payout. So if tier 1 is, going from 78%, or I'm sorry, I'm talking about cancellations, going from 22% to 20% is tier 1, then they're all going to get a payout on a tier 1 level. If tier 2 is 19%, they're going to get a bigger payout, and tier 3 might be 18%. They get the biggest payout of it, and it's split between the team. So you might come up with a few KPI measurements that you want to work on specifically. And then again, during the quarter or 6 months, you strategize around it to get everybody there. I did this with a team a couple of years ago with retention, and we were raising the retention level from 3% in 90 days. The team actually did it by 0.1%. So everyone got rewarded. They were really happy, because when the doctor came to me and asked, should I give everybody a raise this year, and they weren't hitting their goals, I instantly told him no, which he accepted. But I said, let's create a reward system around a measurement that we're really, concerned with right now. And it was his retention. So working with hygiene, working with the front office, how do we, and our DAs, how do we make sure patients were scheduling that next hygiene appointment and keeping them in the schedule? So there were a few different strategies we came up with through that. Part-time employees, sometimes part-time employees are best employees. So I would include them in any reward system that you have in there, and that we celebrate. How do we celebrate as a team? Now, I know a lot of you do Christmas, dinners and such, but, something during the year. And I like quarterly outings, where you can take the team out. Maybe it's to a dinner, maybe it's axe throwing, maybe it's going to Top Golf, so what does that look like to you, to get the team together to talk about the success that you've had as a group and celebrate beyond just the Christmas party. And then creating a really positive work environment. So, one of the things, I've seen in a lot of dental practices, motivation and morale issues go unnoticed. And it definitely starts affecting patient care and team dynamics. And sometimes, we think as leaders, because, everyone's just kind of going through the motion, that everything's okay, and everything's not okay. So again, early warning signs, anything from absenteeism to patient complaints, declining performance from your top team members, and growing tension within the team can indicate a lot of deeper concerns. So in order to maintain that thriving practice, you want to make sure that you're recognizing these signals and taking proactive steps. Again, constant communication, those monthly one-to-ones that you have, and again, 30 minutes, that's all I'm telling you, is to make sure that, again, you're aligned and your team members feel secure about having those conversations with you. And if it's not you, if you have an office manager that is a true office manager, that, can work and coach and guide your teams, then utilize them so that you can be in the back working in the clinic, and you could trust your office manager taking care of that side of the business for you. And then you should be having weekly office manager meetings anyways to make sure that our performance is where it needs to be. So as we looked at all these factors, there were 9 factors of, how we maintain and keep high performers on the team. I hope you guys had some takeaways. I would love to see in the chat what one or two of your takeaways were. So take a minute and just share in the chat. What are you going back with from this? What did I teach you today? This is great stuff. I mean, all these things, holding accountability, it's, it's a job, and they're there to do a job, and you need to hold them accountable to that job. You shouldn't be putting weekly team meetings are a must. Love it. It shouldn't be everything being put on your shoulders because you're the practice owner. This is why you have a team, and I can't talk about the Super Bowl because, yeah, the Patriots are my team. But, you go back to Tom Brady. He may have been the quarterback, but he was leading a team to 6 Super Bowl victories. Sorry for any Patriot hater out there. But, it was the fact that he was leading his team that way. And that's what he's remembered for. It's not the individual, it's the group. Okay. So, for any of you who might be interested in having a further conversation with me, this is going to give you an opportunity to look at, a few things, everything from, a financial forecast outlook to how to work with your team and be a better leader. I would be more than happy to meet with you on how our complete care consulting program could actually help you. Everything from, looking at leadership skills, understanding our finances and how to budget properly so that we're driving the team to a sustainable growth success, to enhancing patient care and business operations. I mean, that's just, I'm talking like, this is just the cusp of what this program actually does for our clients, and doesn't commit you to anything. But if you just want to brainstorm a couple of things with me, I'm more than happy to do that with you.